Time for another category, and in this case, we will discuss the top pharma ERP systems in 2026. So let's dive right in.
Growing a business requires a holistic approach that extends beyond sales and marketing. This approach needs alignment among people, processes, and technologies. So if you're a business owner, operations, or finance leader looking to learn growth strategies from your peers and competitors, you're tuned into the right podcast. Welcome to the WBS Podcast, where scalable growth using business systems is our number one priority. Now, here is your host, Sam Gupta.
Hello everyone, my name is Sam Gupta. I am principal at Elevate IQ. Elevate IQ is the independent vendor-agnostic technology advisory firm. We help our clients with technology strategy, system selection, and change management. On that note, let's go back to today's topic, which is the top pharma ERP systems in 2026. Before we look at the list, we always like to define and provide insights into what we call, pharma and how this segment is structured from our perspective. In this particular case, we are looking at all different companies, regardless of their size. All of those are part of this list, meaning each system will be positioned for different market verticals, but we are looking at all of different size segments. We are also looking at any companies that might be part of pharma value chain, whether these are going to be product companies or services companies. All of those are part of this list. When we look at the closer commentary with each of the system, you might want to pay close attention because that's when I'll be talking about the systems, the perspective that they are designed for and which particular size segment or industry they might be applicable. So pay close attention. And in this particular case, we are looking at all of different business models: pharmaceuticals, nutraceuticals, biotechnologies, cannabis, R&D, consulting, CRO. All of those business models are part of this list. Now, the criteria that we have used to compile this list is product share, acquisition strategy focused on the pharma segment, product roadmap, community ecosystem, win rate, technology strategy, as well as the investors. But now we are looking at AI roadmap as well. So on that note, let's look at the list. Number 10 on our list is BlueLink ERP. And BlueLink ERP, for the most part, is a very small ERP system. It does really well in the very small pharma distribution space. For the most part, it is used by smaller pharmacies. The product does have very deep operational processes. The financial processes may not be as deep as what you are going to find with several other ERP systems. But when you look at the combined pharma-centric capabilities, the kind of processes that you are going to require from the serial number, lot number, different organization of serial number, lot number, sometimes that could be very difficult with the systems that are trying to accommodate many different business models, industries. BlueLink ERP is specifically designed for pharma business model. So even though it's going to be tightly prescriptive, if you are always going to remain, pharmacy-centric business or pharma-centric business, and you are not looking for flexibility with other business model, in those use cases, BlueLink ERP could be a great fit. But sometimes these prescriptive systems may mandate several different tools and technologies that might be part of their portfolio, and it might be harder to decouple all of those components. If you're looking for slightly more flexibility in those use cases, BlueLink ERP may not be the best fit. Also, it does not have as deep manufacturing capabilities. So if you are a pharma manufacturer, in that use case, BlueLink ERP may not be the best fit. So that's number 10. Now, number 9 on our list is SAP S/4HANA. SAP S/4HANA is a much, much bigger product compared to BlueLink ERP. For the most part, pharma companies that use SAP S/4HANA, either they are going to be very large enterprise. There may be cases where some of the mid-market companies may have used SAP S/4HANA as well, but for the most part, they are using it for the GL layer because the operational capabilities that you might require, they are not as built, especially if you look at at their the public cloud product now, with on-prem product, they had a lot more capabilities, but then you also required a lot more add-ons to be able to support what systems such as your Bluelink ERP may be able to support. But technically, SAP S/4HANA is a far bigger system, especially when you need to have different processes supported as part of your custom development processes. In those use cases, SAP S/4HANA is a great fit. With systems such as your Bluelink ERP, for the most part, whenever you are going to require any sort of changes, then you may need to go through Bluelink ERP, because for the most part, these smaller systems are more like apps. SAP S/4HANA is more of a platform as opposed to just the app. So that's where the real difference is. They are providing a lot of different technical capabilities so that you can enable a lot of different, pharma-centric processes. And obviously, SAP S/4HANA is trying to accommodate many different industries. Even for the business models that are going to be very pharma focused, they will still require capabilities from several different industries. So you get that kind of flexibility with SAP S/4HANA. But again, when you look at the deeper operational capabilities, those might not be available. So that's number 9. Now, number 8 on our list is Oracle Cloud ERP. Oracle Cloud ERP is a very similar system as your SAP S/4HANA. It's designed for those larger enterprises. For the most part, the ecosystem, the partner ecosystem they have is very well developed. They are going to have substantial IP promoted through partner network, which is great, but those capabilities may not be available within Oracle Cloud ERP itself, because they are trying to accommodate many different industries, business models, transactions, processes, and sometimes when you are going to create those pharma-centric processes, they might not be as relevant for the other industries. So it's a very common process model, data model that they are trying to provide to cover many different industries. So you get a lot of flexibility, but then you don't get as specific functionality. That specific functionality has to be sourced by either vendors, add-ons, or you have to develop that. So that is going to be a little limitation with Oracle Cloud ERP, but that's number 8. Number 7 on our list is Microsoft Dynamics 365 Business Central. And Business Central is a very smaller system compared to the other larger systems that we have reviewed so far. It's bigger than your Bluelink ERP, especially if you look at the core ERP capabilities that can support many different industries. Those ERP capabilities are going to be much richer from Bluelink ERP, but the specific pharma capabilities that either you have to develop or you will require several different add-ons from the community. The good news is that they do have a community that can provide several different add-ons for the pharma industries, but sometimes you would require expert help to be able to vet how good those add-ons are, how well coded those add-ons might be, and if they can work together. Yes, a lot of those add-ons do get installed together, but they also run into a lot of different issues, especially if you talk about communication between those add-ons, communication between add-on and the core product. So that is always a challenge. And then you are also going to have challenges with several different vendors, contracts. If Microsoft loses that relationship, or the add-on vendor that you might be utilizing may not support the add-on anymore, then the Microsoft Dynamics 365 Business Central core vanilla product may not be as useful, and you might run into challenges there. So that could be a challenge with Microsoft Dynamics 365 Business Central. But if you're looking for slightly more generalized product, accommodating many different business models as well as business processes, especially for global workloads in the SMB space, in those use cases, Microsoft Dynamics 365 Business Central is a great product, and that's number 7. Number 6 on our list is Aptean Process Pro. And Aptean Process Pro is a very prescriptive system. It does really well in the SMB space. It has all of those layers and the components that a pharma company is going to require. But overall, the way Aptean products are written, they might not be as well coded. We have heard from our customers that they struggle with support from Aptean. Aptean ecosystem is not as well developed, so you might not find as many consultants in their ecosystem compared to other ecosystems systems. And then the product itself runs into a lot of different challenges that we hear from our customers. For example, even the basic processes, such as your Excel capabilities or Excel interfacing from the finance capabilities perspective, those are not as friendly, even though they might look good during demos. But for the most part, once you start using that, then you would realize that some of those capabilities might not be as friendly. So those are some of the challenges that you are going to run into with Aptean Process Pro, and that's number 6. Number 5 on our list is SysPro. And SysPro is a great product. The product is designed from scratch for the most part. It does really well in the process manufacturing centric spaces, and that process manufacturing centric space is going to be applicable for pharma centric companies because pharma is very process centric. The kind of bombs these process manufacturing industries use, the kind of serial number organization or lot number organization that pharma companies require is very different compared to the other industry verticals. And that's where SysPro's model is designed for that. The challenge that you might run into with SysPro is it's a very single entity product. Even though you might find some add-ons or they might be able to financially consolidate some of the entities. But for the most part, when you look at a product designed for multi-entity organizations, especially when the organizations might be larger in those use cases, SysPro might not be the best fit. But for the smaller pharma companies, SysPro is a great product. And that is number 5. Number 4 on our list is QAD, and QAD does really well in the pharma space. It's one of the most adopted product in the pharma space. It does support both of the process and discrete manufacturing. It does really well in some of the food manufacturing spaces as well, very similar to SysPro. The kind of model it has, it's very different. Sometimes it can support very advanced process of large companies, which could be an advantage or overkill depending upon how you look at it. But for the most part, it's a very large product. It does really well in the large spaces. But the challenge with QAD is that it's a prescriptive product. So everything that QAD is supplying as part of the suite, you might need to use all of that. Otherwise, you might run into challenges. With other systems, generalized systems, you might have a lot more flexibility in general with their products. So that is number 4. Number 3 on our list is Microsoft Dynamics 365 FNO. And FNO is slightly more generalized product for the most part, especially if looking to consolidate many different global entities as part of one ERP model. In those use cases, Microsoft Dynamics 365 FNO could be a great fit. For the most part, it's going to be lighter in different operational capabilities that you might find with several other systems that we have on this list. So that's going to be a challenge. But overall, Microsoft Dynamics 365 FNO is adopted among very large pharma companies, and that's number 3. Number 2 on our list is ECID-COM. ECID-COM is a great product, very well adopted among pharma companies. It does have very deep operational processes. Its operational model is very similar to other systems. For example, if you compare this with either SysPro or QAD, the kind of costing processes it has, the WMS processes it has as part of the product, it's much deeper. The challenge that you have is the underlying financial layer is very lean and light. It's designed for e-commerce centric use cases. The financial layers are just not as deep as you would find even with some of the smaller ERP systems. So that is a challenge, but that could be a plus as well for some companies, especially if you are outgrowing QuickBooks and you are looking for leaner financial model, especially if you don't have internal expertise to be able to standardize and codify your data models, create the master data structure that is going to be required for ERP. So rather than using an ERP and not structuring the data models the way ERP systems generally require, because if you are going to take all of those workarounds, then you are probably going to run into challenges. With ECID-COM, you get that flexibility because it's not as deep from the financial process perspective, but it's very well adopted among smaller pharma companies, and that's number 2. Number 1 on our list is Sage X3. And Sage X3 is a great product used by some of the upper mid market, some of the large pharma companies as well. It's designed for those audit centric scenarios. The bill of materials or the product model that Sage X3 has, it's very complex model, can support very different use cases from the pharma perspective. Even the properties, attributes that you have generally for the process manufacturing, it's one of the strongest. Even some of the other larger systems may not have as a strong model for the process manufacturing as well as for pharma. So for larger companies, Sage X3 is a great product. But some of the capabilities that you might be able to find with smaller systems, for example, let's say if you look at BlueLink ERP, those capabilities might be supported through their network add-ons. So you get very process manufacturing centric system from Sage X3 perspective, but you would require at least some add-ons from Sage X3 perspective. So that's number one. If you enjoyed this video, we publish these videos on a weekly basis. So like and subscribe on YouTube. This podcast is also available in the audio form on major podcasting platform. These rankings are also included as part of our digital transformation report. We are going to link that. And then finally, if you are looking for deeper insights related to this category, we are also going to link a detailed report. So you might want to check that. On that note, thank you so much for tuning in. I'll see you in the next video.
Thank you for listening to another episode of the WBS podcast. Be sure to subscribe on your favorite podcasting platform so you never miss an episode. For more information on growth strategies for SMBs using ERP and digital transformation, check out our community at WBS.rocks. We'll see you next time.